In Nigeria, women who use and inject drugs often find themselves at the margins of healthcare, isolated by stigma and denied their right to dignity. But across Lagos, Rivers, Akwa Ibom, and Cross River states, a quiet revolution is underway. Through the VIV Healthcare Positive Action funded Sexual and Reproductive Health and Harm Reduction Program for women who use and inject drugs, implemented by Heartland Alliance Limited by Guarantee, lives are being transformed, one woman, one community at a time.
This VIV Positive Healthcare Action Sexual and Reproductive Health and Harm Reduction Project is actually like a dream come true. It's a way of also bridging the gaps, to other program areas that has not been effectively covered. Bringing hope to the hopeless, and also making these young girls and women feel that they are not left behind, and also bringing this kind of projects to their doorstep.
Firstly, I've known VIV for more than one milestone for more than a year. Okay, they came to meet us in our bunk at Akwa Ibom. Okay, then the time when they came, I was smoking, but I didn't really know they came. So we were sitting down. So later on, they told us about the services. So they then directed us to Heartland office at Osongoma. So when we went, I did X-ray. I was able to do cervical cancer screening. Yeah, and then they did us STI test also. And then after that, they also came to our bunk for cohort, where they used to teach us on harm reduction and the rest.
Before they bring the project, I don't know anything. But when they come, they let me know different things. I complain for them. They go test me. They know how to, because before I don't know how to use condom. But now, I know how to use them. Even though I get infection, I complain. They'll give me medicine, then take care of me.
Baby's taking me somewhere. I will get there. It was 2004. I started smoking with weed, cocaine, penta. I used to inject. I was working before, but these hard drugs I'm taking draw me back. I cannot go to work. Before I was working in state government cultural center. Federal government called me for another second chance that God gave to me. I started working with State Art in Unica. The same life I had. I was sacked again from work. I do any kind of thing to have money so I can take drugs. Before I know, I live in one uncompleted building, a bunk. And as I'm sitting here talking to you people, I drop all those things, apart from only cigarettes. And I can't take more than 4 in a day. Now I'm a chorister. Now I'm a choir mistress too. People in my community, they cannot do something without me. In my family, nobody regards me. But now, they cannot do anything without calling my name.
For years, these women were invisible, pushed out of public health systems, criminalized, and left without access to sexual and reproductive health care. But a new approach was needed, one that was rooted in rights, compassion, and inclusion. In 2022, Heartland Alliance Limited by Guarantee began implementing the Sexual and Reproductive Health Program in 4 Nigerian states: Lagos, Akwa Ibom, Cross River, and Rivers. The project, funded by VIV Healthcare Positive Action, aimed to improve access to reproductive health care for women who use and inject drugs through community-based, rights-affirming, and harm reduction-friendly services.
We look comprehensively at bridging the gap between sexual and reproductive health and harm reduction. Telling them about their health and their rights, and at the same time, making them to understand and having the knowledge, the skills, the ability to be able to make informed choices when it comes to their health and their rights.
Since I've started implementing the VIV project. I can say now the VIV project, we have been implementing it for the past 2 years. I was injecting 8 bottles of penta every day, that is 8 ml, 8 ml every day. I did that drugs for 6 years. But in the process of being a peer educator, I reduced. Now, me being the executive director of a female-led period organization, I'm supposed to be an agent of change. That's my #1 coping mechanism. That was the thing that really motivates me in stopping opioid. But I can say it clearly now that I am 2 years clean in injecting penta.
Anyway, I don't already get the experience somewhere before. But why this one, I like it is you people are teaching something gradually, so that person go understand. I benefit a lot. And they used to come here and give us condom, tissue and pad. Sometimes they still feed us.
When I was about 17, 18 years, I was taking a lot of drugs due to lot of problems I was having at that time. I took hard drugs, I inject drugs, I even inject them. So it really cost me a lot. So I had to go on the streets, stay with friends, do a lot of things that I'm not supposed to do as a girl child. They taught us a lot. Even some activities, they do give us some sanitary pad. Even those sanitary pads, it really helped me a lot because when I started menstruating, I was not using pad when I started. So, but with them, I was able to do all of those things. They made me a better person that I am today. Viv invited me for this activity that I learned this skill acquisition, and it has been able to make me start doing puff, and it has really helped me. I do it and sell.
Before I did smoke well, but as of now, I don't stop smoking because I don't have time to stay and smoke, and I don't have time to go to the bank again. Every time to hustling to go to the market. So I'm selling soap now with bathing soap with hypo. They make me happy. They make me have handwork because I've been staying for house.
If me now, I get like daybreak now, I go work. When I go work, I no go get the mind say I won't begin to do all those things. Even though say if I won't even do them, I no go just take them priority like that. It's when these VV people come. So when they begin to teach us different things, we learn a lot. Wetin we not know, through them we learn them, we get to know them.
Actually, it's over a year plus now. I related with them and they've been so good to me. At least I've been able to reduce my drugs. And I was able they were able to give me drugs on the TV because I had TV, so they were able to treat me. And thank God I'm okay now.
I'm happy that I know them. As I know them, and now I'm being a changed person. I'm no more smoking. I'm no more do anything. I'm living fine. Because when I take that smoke finish, my body will weak. I will not remember to bath. But now I give God the glory, and I thank them. They do well.
Before I don't know my left, I don't know my right. We dey live life where please us. We don't know wetin be test. We don't know wetin be hospital. Now when they break, I afford my Igbo smoke. Go buy such a drink. If belle worry you or anything worry you, na sachet. The VIV don't make us, we understand our right as a woman. Before you go to see for this our bunk, then go to beat woman anyhow, they misbehave, they do anyhow. But since where these things come, a lot of women attend the program. So when the man won't raise hand on you, we go say we go call because they drop their number. We go say we go call all the VIV people. Some of the men they don't get limits of that life. They know they beat again.
Since that time, those people where they buy colo from my hands, and they carry them, they don't come. They will come here, come do tests for them. I will arrange those girls, give them. And some girls then go jog like this. Wait train they come, I will go drop them. Some girls when they don't want to do tests, I go by force them when they do tests. Then they do infection for us. And go do am. I go give them room, then go take do am there. Then go do tests for them. Then go for private. No, they no dey pay for the test, yo. Na free. When they come, say they go arrange food, jollof rice, buy am, put am inside takeaway, pack am, come give them for here. Everybody go eat. Both pads, condom, everything. Dettol, soap, close up, Maclean. Then go buy everything, come brush, come dey beat those girls when they dey here.
The VIP project, it don't really help me get my own self-confidence. They will say, some people say I need if you do before, but now I dey get 100% confidence for myself. Say I will do am. Like to talk for myself when people they embarrass me outside, mostly men. I dey feel get strength, not like before where I dey feel. But ever since I begin to come this VIP program, I don't get so many experience. Yes.
Meanwhile, I was smoking. I smoke weed and cigar and a lot of things, but it's not all. So they just came to our street and I was scared before, so they took us to Alliance community member. Since they took us there, we see our Alliance community members there. So they give us HIV drugs and HIV drugs with infection drugs, and with test, with family planning. We do a lot of tests there.
I been no go hospital before, don't you? They don't carry me go hospital, give us things, give me things, give me a condom, tissue, Dettol, all those things. They don't give us.
So this is our safe space. As you can see, it's occupied. So there's a section there, so we'll not disturb them. So let's go to where they have their things also. So yes, this is where the women access their things, access microwave. We have their plates and their things. And this is just where some of them, when they experience gender-based violence, when they experience rape and other things in the community, so they are homeless. So we just find a way. They don't have any skills, anything. So here we also make sure that we give them skills before we let them go out to the community.
These are the voices at the heart of the program. Women who for the first time feel seen, supported, and safe.
We look comprehensively at bridging the gap between sexual and reproductive health and harm reduction. Telling them about their health and their rights, and at the same time, making them to understand and having the knowledge, the skills, the ability to be able to make informed choices when it comes to their health and their rights.
In just 2 years, the program reached over 3,200 women with sexual and reproductive health services, enrolled over 500 women in family planning services, trained 278 healthcare service providers, referred over 1,800 women for HIV testing services, placed about 660 women who use and inject drugs on pre-exposure prophylaxis PrEP, and strengthened referral systems across 4 states. But the real impacts are restored agency, reclaimed dignity, and a future full of possibilities. The journey isn't over. As the program enters its next phase, the vision is clear. No woman should be denied her rights to sexual and reproductive health, regardless of her circumstances.
Thank you very much, and God bless you. I love you.
I have a work to do, and I'm bapping now, and I have everything on myself. So I thank Beef.
This is more than a program. It is a movement, a declaration that every woman's health matters and that dignity, rights, and care belong to us all.